Can everyone see my slide? Okay, then I'll get started. My name is Zhang, and oh, a professor in the School of Information at the University of Texas at Austin. My research area is information behavior and consumer health informatics. So I'm really happy to be here today to share our work on information practices of ovarian cancer patients around genetic testing. Okay, so ovarian cancer is the second most common gynecological cancer in the US, and it is a comparatively serious condition, accounting for more deaths than any other gynecological cancer. So among ovarian cancer patients, about 25 is due to hereditary cancer syndrome resulting from BRCA1 and BRCA2 gene mutations and Lynch syndrome. So the knowledge about these gene mutations can first inform targeted cancer treatment for patient, and second, inform cancer screening and prevention for at-risk family members. So because of these functions, genetic testing has become part of standard care for ovarian cancer patients in the US. Okay. So genetic counseling is an integral part of genetic testing. It's intended to inform patients about genetic testing as a medical process, a medical procedure. So before genetic testing, often the time, patients will go to a genetic counseling session to get informed about what is the test, the procedure of the test, as well as possible outcomes. And then after genetic testing, and another genetic counseling session will take place to go over with the patients about the results and possible interpretations and next steps. So that is the ideal world. Patients have pre and post counseling sessions before and after their genetic testing. But in reality, this is not often the case for several reasons. First, there is a severe shortage of genetic counselors, particularly cancer genetic counselors, so that not every healthcare institution actually provide formal genetic counseling sessions for patients, not even mentioning like before and after counseling sessions. So there's also some inherent limitations of genetic counseling sessions, for example, the session usually often is short. And during this short time period, complex concepts have to be explained to patients. And then there's lots of uncertainties involved in those concepts. And then at the same time, for patients themselves, usually they're under the big pressure of being diagnosed with cancer. So they often have very low cognitive processing abilities. And some people name it cancer brain. So the existing study consistently show that patients have notable unmet information needs about genetic testing. Okay, modern healthcare in the US emphasize patient empowerment and shared decision-making, which requires patients to be informed so that they can be effective participants in their own healthcare. So in this particular case of genetic testing, it is natural for us as information professionals to think about how patients become informed of genetic testing. If there is any need, what kind of informational preventions we can provide to help people become more informed of the process. So we set out to study patient information practices defined as various actions and interactions that patients perform in relation to information. So such as obtaining information, sharing information, and using information when handling and coping with their health conditions. In this case, that's genetic testing. Okay. The specific research questions we ask in the study are, what are the information practices of ovarian cancer patients in relation to genetic testing? And then what factors influence their information practices? So we conducted in-depth interviews with ovarian cancer patients. And we took a phenomenological approach, meaning that we try to understand the patient's experience with cancer diagnosis and with genetic testing in particular from their own perspective. So the participants are either patients or survivors who had taken genetic testing as part of their treatment. So the interview took place in multiple different forms. 6 participants participated in like 3 or 4 focus groups. And 1 participant was interviewed through email because of her preferences. And 14 participants were interviewed on Zoom. In total, we had 21 participants. So the interviews lasted from 1 hour to 1 hour 45 minutes. So we transcribed the interview and then we imported them into MaxQDA software, which is a software to help with qualitative content analysis. So the first step is we closely read all the transcripts and we conducted a free coding. In this stage, we focus on identify 2 themes, 2 kinds of information. One is contextual factors, including participants' socio-demographic and family characteristics, their social environments and interactions, like with family members, and with healthcare providers, and their sentiments and feelings during the cancer diagnosis process, and then extended to have to take in genetic testing and the process of taking test. And their values, attitudes, and beliefs occurred during the entire process. And the second theme we concern, of course, is our key concept is information practices. So we identified their activities and actions related to information. So in the second stage of data analysis, we focused on creating a storyline for each participant. So we used this table format to help us to construct everybody's storyline. So this storyline is try to describe each participants with a little bit more details, and then try to map out the factors that influence their genetic testing related information practices. So in order to identify a range of factors, we utilized this socio-ecological model. So socio-ecological model is a model try to explain human health information behavior, health behavior in general. So it suggests that any human health behavior is influenced by 5 layers of factors: individual factor, interpersonal factor, community factor, organizational factor, and then the larger societal policy environment. So you can see that we identified various layers of factors by following this model. Okay, so here now we get to the result part. So this is the demographic information of the 21 participants. So most of the participants, majority of them are above 40. The age range is 40 to 79. And most of them are white and non-Hispanic, Latino, and with college degree. For most of them, like more than 67% of them, they received their genetic testing between 2018 and 2020. So the study took place between 2020 and 2022. next is their test results. So we have a variety of test results being represented in the sample. So we have positive results, negative results, and variants of uncertain significance means results are uncertain. And we had participants took multiple genetic testing, like a germline test is based on blood test, and somatic test is based on cancer tumor tissue test. So germline being negative and somatic being positive. And then we have 5 participants being germline and somatic both negative. So we have a good representation of the range of results that people receive about their genetic testing results. Okay, so the first question is patient information practices. So we identified 4 aspects of people's information practice, meaning their actions and activities related to information. So first is people demonstrated various different information seeking modes. And second, they utilized different sources for information. And third, they exert different kinds of information processing processes in the information seeking. And then they demonstrated different use of information in the process. So this, like the differences along these 4 aspects of information practices allowed us to categorize participants into 3 information practice style. First one is passive, semi-active, and active information practice patients. Okay, so first let's look at the first category. Among the 21 participants, 10 of them, almost half of them, belong to this style, so passive information practice style. So look at their information seeking mode is how they approach information. So mostly they're receiving information from healthcare providers or sources provided by them, like brochures, information packets. And second, they encounter information, including exchange information with family members or exchange information with nurses in medical settings. And then the third, they delegate information seeking to family members. So consistent with this information seeking mode, they primarily use healthcare providers and healthcare provider provided sources for their information, as well as family and friends. They used other sources include newspapers, and NOCC is the National Ovarian Cancer Coalition. And for information processing, they mostly rely on their selves or their family members' knowledge to help them digest the information without referring to external information sources, such as the internet. And then they expressed having difficulty comprehending information. So even they just passively receiving information most of the time. In terms of information use, this group of people actually, they didn't have explicit usage. They didn't put the information into any action. Okay. All right, the second kind is semi-active information practice. So 7 patients demonstrated this style. So compared to the passive style, we can see that this group of participants also demonstrated the information seeking mode of receiving information from healthcare provider and family members, encountering information in their information environment, and delegating information seeking to their family members. But additionally, this group has 3 additional information seeking mode. One is they actively seeking information. They try to search for information. And they collaborate with someone, particularly family members, to seek information. And then they subscribe to sources to monitor information, intentionally monitoring, keep updated with information. So when we look at the sources they utilized, we observed a very clear expansion of the use of online sources. So I highlighted them in blue here. So we can see that a number of online sources are being used, 23andMe, And some of the social media platforms, online communities, Google, WebMD, and PubMed. There's TV as other sources. So compared to passive groups, they also demonstrated more variety in information processing. So they, like the people with passive style, they also express the difficulty of comprehending information. But beyond that, they also pointed out that when they are seeking out additional information, they are trying to be very cautious about online information quality. And sometimes they feel overloaded by information, and sometimes they are trying to avoid the information. So this all three of them are kind of in company with their effort to going online for health information. So this group of patients, they do put information they find into work. So they advocate. So primarily they advocate, they try to suggesting to family members that they should take genetic testing to find out their cancer risks. All right. So the remaining four participants of our study showed active information practice style. So compared to the previous semi-active style patients, this group demonstrated all kinds of information seeking mode, meaning that they approach information in various different ways, except this one. They never delegate information seeking to other people. And then in terms of sources, compared to semi-active information practice patients, they tended to rely more on scientific resources, like the NIH sources and the Myriad website. So Myriad is a cancer genetic testing company. Okay. So in terms of information processing effort, this group, similar to other two groups, they also said that they have difficulties in comprehending information. But compared to the semi-active group, they spend more time discerning and evaluating information, not only just being cautious about it, but they are actively performing evaluation of the information. This group didn't express about feeling overloaded by information or making any effort to try to avoid information. So in terms of use, I mean, this group is really making use of the information they find. So in addition to advocating family members to take genetic testing, they make effort to learn about the subject themselves. Like a woman in our study, one participant in the study looking for various sources and trying to piece like different puzzles together to have a more comprehensive understanding of what genetic testing and what it means for cancer treatment. And then they also try to educate other people about genetic testing, not only advocating them to take it, but educating them about what it is, what is the function. So including educating family members, female friends, and ovarian cancer patients about genetic testing. Okay. So now we see that people demonstrate very different kinds of information practice style when they approaching information for genetic testing. Okay, so now let's take a look at factors influencing their information practices. So remember that we used this socio-ecological model to help us understand what kind of factors influence this behavior. So the first level is individual. And we identified 6 factors that influence how people approach, how people get informed of their genetic testing. So first is life stage. Early in the life stage, so when patients are younger, they are more likely to actively seeking for information and actively digesting information, processing information. When they are older, the chance that they're less likely to do so. They're more relying on healthcare providers. Second factor is family history. So if a person has a family cancer history, and the person is more likely to take genetic testing because of like the risk concerns, and because of the potential of the results informing family members of their risks. But for people without family history, they are less likely to take genetic testing, and less likely to seek more information about it. And the third reason is biological conditions. Here is represented by their cancer genetic testing results. So if people are having negative test results, it's much less likely that they will actively go out to look for information. But for people with positive results, they are more likely to do so, and they are trying to find out, how they can make use of the test results for their treatment or for the prevention of cancer for their family members. The fourth factor is individual people's attitudes towards information. So this is very interesting. And some people think that information is empowering, but some people think that, at this stage, information is really a burden. So here are two example quotes. So participant 11 said that, information gives you some control over how to take care of yourself and to make better decisions for your health, and to gives you more power over something. So people have this attitudes towards information. Obviously, they are more likely to look for it. And so this patient's participant 21 mentioned that sometimes ignorance is a bliss, and you just learn what you have to when you need to. So she's more passive in terms of looking for information. The fifth factor is perceived knowledge base concerning genetics and genetic testing. So for participants who perceive themselves to have more knowledge about genetic testing or genetics in general, they are less likely to look for information. So we have two nurse participants, retired nurse participants in our study, and both showed less tendency to look for information because of their existing medical knowledge and their knowledge about genetics. And then the sixth is coping style. So this is very consistent with the existing literature on health information seeking. So when people are adopting emotion-focused coping, they are less likely to look for information. But when they are trying to adopt more problem-solving focused coping, they are more likely to look for information. So the second layer of factors are interpersonal factors. We identified two interpersonal factors. The first is perceived risk to family members. So when the perceived risk to family members is low, they are less likely to take genetic testing and to look for information. And if the perceived risk to family members are high, and the participants are more likely to look for information. A lot of the times when they are looking for information, they have their family and friends in mind. So that is a motivating factor. The second factor is how much involvement family members are in the participants' treatment process. So when family members are highly involved, it leads to collaborative or delegated information practice. So I have two examples here. So P14 showed a collaborative information practice with her family members. So she said that when I go into the oncology department there, they're always saying, you guys are more informed than most of our patients. And like I said, that's due to my partner looking up everything and researching and understanding, and then, bringing it down to me. And then they have conversations together before they go meet with healthcare providers together. And in the second case, family member involvement leading to delegated information practice. So P9 said that I don't believe I did searches for information about genetic testing before taking the test. I went with what my sister was saying. She researches all kinds of stuff. And so I went with her saying, you got to do this. And that's what we did. Okay, so the third layer of factors is organizational factors. So the first factor is organizational policy. So for organizations that provide more supportive policies with regard to genetic testing, like has less restrictive criteria for qualifying patients for genetic testing, the prescription of genetic testing. And then in those organizations, patients are more likely to take genetic testing, and they are less likely to seek information for it because they receive the information from the organizations. But on the contrary, if the organization set up a lot of roadblocks for patients, preventing them to receive genetic testing, and it's very likely that some patients will go out to actively seeking information to get the test done. So that leads to more active information seeking. And then the second reason factor is doctor-patient relationship. So some patients has very frustrated with their healthcare provider. In those cases, they tended to do more research, information finding. And for patients who trust their doctors, and less information seeking is taking place. So here, the quote, the participant 8 said that shows, she has frustrations with her doctors. She said, and I'm ultimately frustrated with the doctors. Truly, the doctor's responsibility to see what this stuff gets done. I'm not wanting to sit there and be quiet. I have my list of questions. Every time I go into the doctor's now, this, that, and everything under the sun. And then the second patient's participant 11, she trusted her doctors. She said, no, I did not do any additional information search for genetic testing information, not before getting the test. I was pretty much just ready to do it. To me, there were no disadvantages of doing it. I trusted her. So the fourth level is community factors. So the community communications, community interactions and dynamics really have influence on participants' uptake of information seeking. So here, the ovarian cancer community interactions encouraged information sharing and advocating among patients. So participant 15 said that we used to meet once a month. We would have chapter meetings, and the purpose of the support group wasn't just that we raise money. So this support group is ovarian cancer support group. We participated in health fairs and tried to get information out to people in general, and women in particular, about ovarian cancer, and including genetic testing, because people didn't know very much about it. Okay, so in the second case, it is a virtual community, but this virtual community also have influence on whether people would seek more information or not. So participant 13, tell the story about her accessing online communities, and there was not so great stories there leading her to information avoidance in online health communities. So she said, and I think a lot of people wanted to know other survivors and their stories, but that wasn't easy, and they are not always, or the more often they're not great stories. I started really wanting to make sure my mind was as healthy as possible, and I'd start doing some meditation and just trying to keep my body not at a stressful level. And I felt like I had to avoid all information for that reason. Okay. So the final level is the larger societal environment involving policy and information environment. So there's two factors in this layer. So participants seem to be well informed that there's always advancement of cancer treatment and in general, and genetic testing in particular. So the awareness motivates them to keep updated about the most recent advancement and development. So that encourages active information practice. So patients with more awareness of the advancement are more likely to like monitor information as well as actively seeking information. And then the general information environment. So the quote here shows that poor information environment discourages active information practice. So in this case, is insufficient information specific to ovarian cancer. So participant 17 mentioned that ovarian cancer is rare, and clear cell carcinoma only makes up 3% of those cancers. And most of them are in the bladder and not ovary. So trying to get specific information on that and what kind of genetic testing is done for that, thank God, because there's not that many patients that information is not out there. So what I did get to see was, not in my lane, I guess, is the best way to put it. So because of the lack of information out there, leading to this poor information ground, poor information environment in relation to ovarian cancer genetic testing, discouraged this woman from actively seeking information about it. Okay, so now you see our research findings about different styles of information practices demonstrated by ovarian cancer patients. So we see that their styles differ very clearly, and that signals a need for differing strategies to keep patients informed of their healthcare needs. And we also see that genetic counselors and professionals on cancer care teams were used as a source of information for every participant, regardless their information practice styles. So that it is easy for us to see healthcare providers are gatekeepers of genetic testing information for patients, particularly those with a passive information practice style. So patient education in healthcare setting is particularly important. So we see that multiple levels of factors are contributing to how patients approach cancer genetic testing information. So their information practices are shaped by multi-level factors. And to keep themselves informed, patients, we can design different interventions. So information interventions can carefully leverage factors at all these different levels, including family, community, healthcare organization, and larger societal level. So here are several examples of possible, information interventions to promote information and understanding of cancer genetic testing. So first is at the interpersonal level, we can consider the information needs and practices of people closest to patients who sometimes take on supportive role in patient information seeking. So keep their family members, keep their close friends informed of it will have positive impact on patients. And then the second level, at the community level, so we can diversify information in communities to promote positive thinking. So, we just see an example of patients were discouraged by not no good stories in online communities, and which makes us think, we should promote more positive thinking in those communities. Maybe that would encourage patients to go there and get informed. At the organizational level, and we can involve survivors to serve as patient educators and advocates. So this is very likely to promote patients to become informed of genetic testing. And at the social information infrastructure level, And we needed to have proper infrastructures to keep patients updated as cancer treatment and genetic testing develop. So this is related to national health information infrastructure. So we needed to have communication channels to be established, from like CDC, from NIH, to timely inform our patients of the new development in cancer treatment and genetic testing. Okay, so this, we are getting to the end of the presentation. I want to first thank our participants. All of them expressed that they participated in this study because they want to benefit other women. We really appreciate their effort and time spent with us. So I also want to thank my collaborators and including student collaborators. The project was funded by the Humanities Institute and the Center for Health Communication at UT Austin. Thank you very much for listening to the research. I'm happy to take questions.
Feel free to either put questions in the chat or unmute yourself, and you could ask your question just directly. I don't think we put any restrictions on that. So, or if you have questions about the graduate programs and information studies at UT Austin, you can ask those at this time too. Okay, if there are no questions, or maybe in order to encourage questions, I'm going to stop the recording. And